Good evening. Glad to have you with me. I'm Jenny Day. Brandon is out on assignment. Well, tonight, more than half of U.S. states are reporting a rise in new infections in what some say is the dreaded fall surge. Health experts attributing multiple factors to the rise, including pandemic fatigue, ignoring health guidance, and the reopening of schools and universities. But as Camila Bernal explains, one of the likeliest factors contributing to the spread, family gatherings.
COVID-19 numbers once again climbing back up across the country.
The numbers are moving in the wrong direction.
The U.S. has now topped 220,000 COVID deaths, a number some experts worry may also begin to climb faster.
At the very least, assume everyone you come in contact with is asymptomatically infected and contagious. Assume that, and then wear masks and social distance.
Hospitalizations also on the rise, with at least 14 states reporting peak hospitalization numbers in the last week. And it could get worse.
Over the next 5 or 6 months, I think up through February or March of next year, we are heading into the worst part of this pandemic for this country.
And as the holidays approach, many doctors asking people to be extra careful.
Avoiding large gatherings of families, because we've seen a lot of family transmission.
Meanwhile, the NIH director says we may have to wait longer for a vaccine.
I would think it's very unlikely, given the timetables and the standards that have to be followed, that you will hear about an emergency use authorization before late November at the earliest.
But even once a vaccine is available, public trust remains a question.
Public health entirely hinges on public trust, and specifically trust in our top government scientists.
I'm Camila Bernal reporting.
And as COVID-19 cases begin to rise in other parts of the U.S., same goes for Imperial County. Hospital officials in El Centro tell us they're bracing for a second wave. El Centro Regional Medical Center says its COVID-19 patient count is slowly starting to rise again. And although they are prepared for another surge, they say now is not the time to let your guard down. The hospital went from having just a handful of COVID-19 patients to now having 31. Some of the resources the county had, like extra beds at the care facility at Imperial Valley College, are no longer available, but the hospital says that extra help can be reactivated if needed.
On the COVID side, though, unfortunately, I think we've let our guard downs in people's homes. For example, that one family that we said 10 out of the 11 were COVID positive, that's within one household. So we've got to be careful even among ourselves. Where is our members of our household going to, and what are they bringing back with them?
Imperial County remains in the worst tier in California. Although the county came close to moving to the next tier, the steady rise in COVID-19 cases is now pushing the county farther away from making that a reality. So to give you a better idea of where we stand, Imperial County is reporting 59 new cases today alone. The positivity rate is still above 10%. 307 people are known to actively have the virus right now. Yuma County is reporting 23 new cases today. 27 people remain in the hospital, and the majority of the cases still include those between the ages of 20 and 44.